I'm Chris Bell, physiotherapist for the Western Bulldogs. I'm here today on behalf of the Victorian Amateur Football Association and LifeCare. We're going to be running through some taping techniques and some injury prevention tips. Hope you enjoy. A question I get often asked is to give help to people who don't know how to differentiate from generalised soft tissue tightness to the possibility of the athlete sustaining a soft tissue injury. I'm going to give some generalised tips to try and differentiate the two, to try and help you decide if the athlete should continue to play on or whether you should pull them off and go into an acute management mode. Okay, the first thing we're going to look at is how to look at a calf. The three simple principles we're going to look at are: do they have an acute episode of pain, if they have pain on stretch and pain on contraction. If they have those three things and it's in a localised spot in the calf, it's very possible they've damaged the actual muscle tissue. If they have more generalised symptoms on these tests, you can treat it more aggressively and treat it more as a generalised soft tissue tightness. Okay, the first things we're going to look at are the stretch of the calf muscle. The calf's made up of two main muscles, the soleus and the gastrocnemius. We need to test both muscles when we're testing the calf because often either or muscle could be associated with the injury. The first test we're going to do is the length test of the soleus. All you need to do is to take the knee over the toe, keeping the heel flat on the ground and the arch nice and high. The athlete will take it into a stretch position, and then you ask the athlete where in the position of the calf do they feel that stretch. If it's more localised in terms of one spot over 2 to 3 centimetres, it can be a cause for concern. This is compared to an athlete that feels it very generally around their Achilles type area. The next thing we need to look at is the length test for the gastrocnemius. In this test, the leg comes back. Once again, foot straight, heel down. The gastrocnemius has an attachment over the knee, so it's active on straight leg rather than bent knee. So in this position, you get the athlete to bend their front knee forward, and they should feel a more generalised stretch in their calf. This focuses on the gastrocnemius muscle. Once again, it's important that you differentiate, is that tightness in one particular spot or is it the generalised calf as a whole? That'll give you an indication if they have got some local muscle overload or if it's just a general tightness. The next thing we're going to look at is the strength test for those two muscles. Once again, we need to load the soleus with a bent knee contraction because that's how it operates. We also need to look at the gastrocnemius on a straight leg contraction because that's its function. So first of all, standing straight legged for me please. If you can push up onto your toes, so you load the gastrocnemius with a straight leg contraction. If you have the ability to do so, you also need to load it into a single leg straight leg contraction and then into a more dynamic test like a functional hop to make sure that the integrity of the muscle is really good. If you once again have localised symptoms on these testings, it can give you an indication there's local muscle pathology. Now the next test we're going to do is a strength test for the soleus. If you can bend your knee for me, with the knee in a bent position, maintain that knee bend position and push up onto your toes for me please. So now we're loading the soleus muscle, part of the calf muscle, because the knee's in a bent position, and relax. And we're loading the soleus muscle on a bent knee contraction. So it basically takes some load off the gastrocnemius and applies more load to the soleus muscle. Once again, do it into a single leg, progress into a single leg test where they do a single leg bent knee heel raise, and then also do it dynamically with a hop and a jump with a bent knee position. Once again, dictated by their symptoms, guide your next management phase in terms of palpation. Can you line your stomach for me? Okay, with the calf muscle relaxed, it's important you do a thorough examination of palpation tenderness. So starting off at the bottom part of the calf, working your way up, asking for subjective feedback off the athlete to where they feel their tenderness. Working through the inside, working through the outside and the central part of the calf muscle. If they have generalised tenderness, it's not so much of a concern and they should respond really well to generalised massage. If they have an area of localised muscle tenderness over a sort of 2 to 3 centimetre area that's consistent with their signs on stretch and contraction, it's a cause for concern and the athlete probably shouldn't continue to play. If they have the generalised symptoms, trial the massage, repeat the test that we've just gone through. If you happen to have cleared their symptoms, you can then return the athlete to play with a low level of concern compared to the high level of concern that would exist if there was more localised muscle pathology.